Before I retired from the Air Force, my doctor diagnosed me with hypertension.
Over 1/3 of veterans have high blood pressure, also known as hypertension, making it the most common chronic medical condition among veterans. If your healthcare provider diagnoses you with hypertension, or if a diagnosis of hypertension is uncertain, you may be asked to measure your blood pressure at home. This is called home blood pressure monitoring.
My doctor wanted me to take my blood pressure at home, so the nurse told me to get a tape measure and measure the circumference of my upper arm to make sure that I had a blood pressure cuff that fit, and to sit quietly for 5 minutes before taking my blood pressure, and then to take it twice and record the second one in my book.
Before measuring your blood pressure at home, it's important to select a cuff that is the correct size for you, or you may get a reading that is not accurate. To determine your arm size, use a cloth measuring tape and measure the circumference of your upper arm. Make sure your monitor includes the right size cuff for you. Follow these guidelines to measure your blood pressure correctly at home using an automated blood pressure monitor. 30 minutes before you take your blood pressure, do not smoke, exercise, or consume caffeine. Do use the bathroom if you need to. 5 minutes before you take your blood pressure, sit quietly. Sit with your back supported. Keep your feet flat on the floor and do not cross your legs or ankles. Your arms should be unrestricted by clothing and supported at heart level. Following the instructions for your monitor, put the cuff on by wrapping it around your arm above your elbow. Face the palm of your hand up to relax your muscles. After relaxing for 5 minutes with the blood pressure cuff in place, you are ready to measure your blood pressure. Continue resting your arm on a table or another flat surface at the level of your heart. Do not talk, read, text, or watch television while taking your blood pressure. Follow your doctor's guidance on how often to measure your blood pressure. Following the directions for the monitor you are using, press the button to start the machine. The cuff will inflate and slowly deflate by itself. Each time you measure, take 2 readings, 1 minute apart, and keep a record of the second one. When the monitor has stopped taking your blood pressure, it will display 2 numbers. The top number is the systolic blood pressure, and the bottom number is the diastolic blood pressure. Most blood pressure monitors also measure and display heart rate. Remember, measure your blood pressure twice and record the second one. Write down the date, time, systolic and diastolic measurements, as well as your heart rate if it's displayed on your monitor. Take your written blood pressure log with you to your next doctor's office visit if you have been instructed to do so. Let's review the guidelines for measuring your blood pressure at home. 30 minutes before measuring your blood pressure, do not smoke, do not exercise, do not consume caffeine, but do go to the bathroom if you need to. 5 minutes before measuring your blood pressure, your arm should be unrestricted by clothing. Your arm should be supported at heart level. Put on the blood pressure cuff. Sit with your back supported. Keep your feet flat on the floor. Do not cross your legs or ankles. And sit quietly for 5 minutes. While taking your blood pressure, do not talk, do not text, do not read, and do not watch television. Remember, take 2 readings, 1 minute apart, and keep a record of the second one. After the second measurement, record the date, time, systolic and diastolic measurements, and your heart rate, if it's displayed by your monitor. To learn more about the management of hypertension, visit the U.S. Army Medical Department Office of Quality Management website at the following address. Also visit the VA DoD Clinical Practice Guidelines website at the following address.